Welcome to this deep dive. Today, we're really getting into something vital in healthcare, something that affects, well, everyone, quality and safety.
Absolutely. It's fundamental.
And you've pointed us to some great sources. We're looking at organizations setting the standards, Joint Commission International JCI and India's NABH.
Right, the National Accreditation Board for Hospitals and Healthcare Providers.
And also IASQA, the International Society for Quality in Healthcare. Plus, we'll touch on how practical tools like dashboards are being used for improvement.
Yeah, pulling insights from a podcast on that topic, too.
So our mission really is to understand how all these pieces, the organizations, the tools fit together to hopefully make care better.
Exactly. It's about seeing the whole picture, the sort of ecosystem of quality improvement. Should we start with the big players?
Let's do it. JCI first. This name comes up constantly in global healthcare. They've been doing this, over 20 years?
Yeah, quite a long track record. Speaks volumes.
And their mission statement: to enable and affirm the highest standards of healthcare quality and patient safety for all. It's ambitious.
It is. And the reach is, well, pretty staggering. Over 70 countries, you said. Asia, Europe, Middle East.
Africa, Latin America, more than 1,000 accredited programs, hundreds of experts. That scale alone tells you something, doesn't it?
It really does. It suggests that organizations worldwide see value in what they offer. It's not just about, getting a certificate. There must be real substance there.
Like that point about medication reconciliation, that seems like a concrete example.
Exactly. It's one of their key standards. And hospitals that really nail that process during patient transitions, they demonstrably reduce medication errors. That's a direct safety impact.
Okay, so shifting gears a bit, let's look at India's NABH, part of the Quality Council of India, but focused specifically on India.
Right. Setting up accreditation tailored for Indian healthcare organizations.
Their goal seems to be meeting patient needs there and setting benchmarks relevant to the Indian health industry. And, importantly, they have functional autonomy.
Which is key. It allows them to adapt to India's specific context, the resources, the challenges, the patient demographics. It's not a one-size-fits-all approach.
So JCI's more global benchmark, NABH, is deeply rooted locally. Makes sense.
Precisely. That local tailoring is vital for driving change that actually works on the ground in India. Their independence lets them evolve as needed.
Then there's IASQA, International Society for Quality in Healthcare, also a long history, over 30 years.
A member-based nonprofit.
And their approach seems, broader. They're promoting quality improvement globally, but through lots of different ways.
Yeah, it's not just accreditation. Education, knowledge sharing, external evaluations, supporting whole health systems.
And connecting professionals, again, over 70 countries. It sounds like they're trying to build a sort of global community for quality.
That's a great way to put it. They understand that improvement needs constant learning and sharing. You see it in their big conferences, like the upcoming one in São Paulo.
Right, focusing on inclusive health systems, technology, and humanity.
Exactly. Bringing people together. And beyond events, they have journals like IJQHC and IJCOM's, tapers, fellowships. It's all about spreading knowledge and building capacity.
Okay, and the final piece for this overview, dashboards in quality improvement. From what we saw, these are basically visual tools, right, showing key data.
Pretty much. Think of them like a car's dashboard or an airplane cockpit's controls. They pull together important metrics so you can see performance at a glance.
So instead of digging through reports, teams get a quick, clear picture of how their QI efforts are going.
That's the idea, transforming data into something you can actually use. The challenge, of course, is making sure you're showing the right signals, not just noise. An effective dashboard cuts through the clutter.
Okay, good overview. Let's dig into accreditation first. JCI and NABH. JCI's accreditation, we know it's based on these tough international standards. Big focus on patient safety.
Yes, those international patient safety goals are central. Things like correct patient ID, safe medication use, reducing infections, the real critical stuff.
So what's the process like if a hospital wants that JCI stamp?
Well, it's rigorous. An international team comes on site, does a deep dive. They look at everything, building, clinical care, how things are run, leadership, comparing it all against hundreds of standards.
Wow. Intense.
It really is. It forces a hospital to hold a mirror up to itself.
And the feedback from hospitals that have done it, it seems really positive beyond just the certificate. Like, Alex Lon in Hong Kong called it a fantastic team-building exercise.
Yeah, that came up. And others mentioned the competitive advantage, like Shiji Kurian at Burj Farha, or strengthening community confidence.
Yeah, Maud Sadek from Emirates Hospitals talked about better risk management, and Roxana Fulton at Cornish Hospital stressed creating that patient safety culture.
Exactly. These comments show it's transformative. The process itself pushes teams to work together, question how they do things, adopt better practices. It improves communication, coordination.
And the public trust that comes with it is obviously a big plus.
Absolutely.
Yeah.
It validates that internal effort externally.
Okay, so now NABH in India. Similar goal quality, but tailored. If you're a hospital in India, how do you choose? What's the difference in focus?
Good question. NABH standards are built for India. They consider the regulations there, the resources, the specific health needs. They might emphasize national priorities differently.
So more locally relevant benchmarks.
Precisely. JCI offers that global standard, which might be better if a hospital has lots of international patients or aims for that global recognition. NABH is really tuned into the domestic context. The hospital strategy kind of dictates the best fit.
Makes sense. Now, ISQA. Less direct accreditation, more fostering the ecosystem, you said. How does their work actually make a difference in hospitals day to day?
Well, their influence is often indirect but significant. They develop guidelines that shape policy. Their experts often help countries build their own national quality plans.
Okay, so setting the stage, almost.
Kind of. And by training people through fellowships, they're creating leaders who then go back and drive change in their own systems. So it ripples outwards. They're building capacity globally.
The think tank and connector, like we said. Okay, that leads us neatly back to dashboards. You mentioned 3 types. Operational.
Right. Operational for the here and now patient wait times, staff levels today. Strategic for the long view patient satisfaction trends, readmission rates over months, progress towards big goals like accreditation.
And analytical.
Analytical is for digging into past data, looking for patterns, comparing departments, figuring out why infection rates went up last quarter, that sort of thing.
So to make these actually useful for, say, a busy nurse or doctor, what's essential?
Number 1, real time or close to it. Data needs to be fresh to be actionable. 2, user friendliness.
Yeah.
Has to be super clear, easy to grasp, no clutter.
Right. If it's hard to use, they just won't.
Exactly. 3rd, customization. The ED team needs different info than the billing department. And 4th, integration. It needs to pull data automatically from the EHR, other systems. Avoid manual entry headaches.
That example you mentioned, Dr. Khanna's emergency department, that sounded like a perfect case of an operational dashboard.
It really was. They tracked wait times, where patients were in the process, identified bottlenecks, all in real time.
And they cut wait times by 20%, boosted patient satisfaction, just by having that immediate visibility.
That's the power of it. Seeing the flow lets you manage the flow. It enables immediate adjustments.
But it's not just seeing the numbers, is it? It's tracking the right numbers, the ones linked to your improvement goals.
Absolutely. And providing context. A good dashboard doesn't just show a spike in falls. It might correlate it with staffing levels on that shift, or maybe a recent change in flooring. It helps you understand the why.
Providing actionable intelligence, not just data.
That's the goal. Moving from data points to actual insights that guide decisions.
So, thinking about how this all ties together, could a hospital pursuing JCI or NABH accreditation use dashboards to track their progress against those standards?
Oh, definitely. It's a perfect application. They could visualize their performance on key safety goals, quality metrics required by JCI or NABH. It provides ongoing monitoring.
Helps them stay on track, identify problems early.
Exactly. It makes demonstrating compliance much more dynamic than just pulling records once every few years. And more importantly, it supports sustained improvement.
And the work ISQA does, promoting best practices and sharing knowledge, that could help hospitals figure out what metrics they should even put on their dashboards, right?
Absolutely. ISQA's resources, their evidence-based guidelines, can directly inform dashboard design, making sure you're tracking measures that are known to be impactful based on global experience.
So ISQA provides the what to measure guidance, and dashboards provide the how to see it tool.
In a way, yes. It connects the global knowledge base to local action.
And we even saw there are support services out there, like Supremediq, helping hospitals with things like getting NABH accreditation or maybe implementing these QI tools.
Right. There's an ecosystem of consultants and service providers who help bridge the gap between the standards or the technology and the day-to-day reality of running a hospital. They provide that practical implementation support.
So stepping back, we've got JCI and NABH setting standards, providing that accreditation framework, ISQA building the global community, sharing knowledge, and then dashboards as this really practical tool for organizations to monitor themselves and drive change using data.
It's a combination, isn't it? The external standards, the shared learning, and the internal tools for continuous monitoring and improvement. Each plays a part.
It really paints a picture of a multi-pronged effort to lift the quality and safety of care everywhere.
That's the ultimate aim. Better systems, better outcomes for patients.
Which leaves me wondering, as we think about this blend of, formal standardization from bodies like GCI and NABH, and this real-time data-driven monitoring using tools like dashboards, how close are we really to a future where consistently high-quality, safe care is just the norm everywhere?
It's a million-dollar question, isn't it?
Yeah. What other questions does this raise for you, thinking about how healthcare quality keeps evolving? What's the next frontier?